We have stark warnings about where bulk billing is headed, that it could be very difficult, if it's not already, to find a bulk billing doctor. Joining me now in the studio is Australian Medical Association President Steve Robson. Thanks for your time. What I find fascinating about this is the official figure from the government is 88% of all GP attendances, is what it says, are bulk billed. That just doesn't compute with anyone I talk to from all around Australia as to their experience or even trying to find a bulk billing doctor. What is the real figure?
Look, I don't know how the figures are arrived at and what the government's method of doing it, but I'm with you. I think the community experience that it's very hard to get in to see a general practitioner at the moment, and general practitioners just can't afford to run their practices and do a large amount of bulk billing. So it's a big problem, and it's something that we need to address rapidly.
But do we need to know, first of all, what the numbers are and delve into this properly? Because this headline figure always sounds great and it's so high you'd think, well, the system's going beautifully. But do we need to really dig in and see what the numbers are, where people just can't get an appointment and why it's happening?
Look, I think, as always, it's very important to have clear data to help guide us. But at the end of the day, I think the community experience is important, and we need to address where the problems lie in people being able to get into a GP and see a GP affordably. And I think we've got the opportunity now to rejig Medicare, to modernise Medicare and try to improve things for Australians who need care.
The comments from medical bodies today are all about, well, it's about the subsidy. At the same time, doctors that run a surgery make pretty good profit, right? I mean, is that really what it's about? They're still making money overall.
So I think I don't quite agree with you there. I think certainly a number of the larger corporate practices have very big economies of scale, but a typical suburban practice in a town, which is what a lot of Australians will see, are under great financial pressure. The MBS rebate really, in real terms, has gone backwards for a long time, and inflation's gone up. So it makes it really difficult, and we've got to address that and modernise Medicare.
And as part of that whole, I suppose, investigation as to where these rates are going, it could reveal, what are the true costs for doctors? How much are they really going up? How much of the story is about cost pressure and other elements, perhaps? I mean, maybe costs are going up because they're too high and doctors could cut some costs.
Well, look, I think one of the things that we're looking at today, and we're going from here to release of a great plan that we've got to make wound care much more affordable, and we're hoping to save the government a large amount of money to free up resources from GPs. So I think there's a lot of opportunity to modernise the way that we do things and really try to make the Australians who really need wound care or any other sort of care much more accessible and affordable for them.
So that means if you look at things holistically, it's not just all about we need more money here, more money there, save some there, spend it here.
I think one of the things that is absolutely clear is that general practice, for example, is a huge cost saver because it keeps people out of hospitals, which are very, very expensive ways to treat people. And the more we can do to keep people well cared for in a general practice, it just saves money overall from the health budget, and that's what we all want.
Wound care is something that perhaps wouldn't instantly get a lot of attention for viewers. You talk about cancer research or so, and they go, oh, great, how can we cure this? But this is so debilitating. I mean, my dad's had a chronic ulcer for about 4 years. Cannot fix it. And two interesting elements I find. First of all, his initial treatment from a hospital, they sort of got him in, gave him something and he left. And once the wound got bigger, it's been impossible to heal properly. Absolutely. Is there an issue with the way the medical profession overall treats wounds and understands them? Specialists? What's going on here?
So it's a multifaceted problem, but you're absolutely right. Almost 500,000 Australians have a wound like this at any given time, and something like $3 billion is spent every year on wound care. And the consequences of getting wound care wrong, as you say, are enormous costs to the health system. So we're looking at ways to improve the way that general practice can offer wound care. We keep people out of hospitals, as you said, the resources are often not there, and we have the same set of eyes looking at wounds. We're upskilling people, we're making sure that things are done on a team basis, so working with nurses and podiatrists. These are our plans, and I think this is one example of how we can work to make the health dollar spend much better.
So when you say the same set of eyes, you have specialty divisions, whatever they might be, within GP practices, and that person the same person actually sees the wound. Because this is the other thing. I mean, I've got some pretty gruesome photos saved on my phone because the next carer that comes along says, "How was this 2 months ago?" And I have to send a picture along. That's such an issue with the wound because how it looks, it's all about how it looked on that day compared to 2 months ago, 6 months ago, a year ago.
And we're all about giving the patient a home. So putting the patient at the centre of care with a GP that they voluntarily set up what we call a medical home with, and the GP brings the resources around the patient. And I agree with you, continuity of care in that setting is just absolutely critical.
The other aspect, education, because if we feel like we might have a heart issue, we'll rush off to the doctor.
Yeah.
Skin cancer, we're pretty good at these days, I think, going, I'm going to get that mole checked out. A wound, we think, I'll put a Band-Aid on, some antiseptic. It's the early stage, if you can nip it in the bud, it could save you years of pain, time off work, time in hospital, productivity. It's just incredible.
I couldn't agree with you more, and I think it's a great example of education and upskilling, building a team, having a home for the patient so that the same person is looking after them. Those are the sort of things that will bring efficiencies and will make the patient's life better, their family's life better, and they're things that we can work on, and we've got plenty of ideas.
All right, the call's going out today. We'll see what the government has to do about it because it's an important area and it gets a bit less attention than others. Dr. Steve Robson,
Absolutely.
thanks for your time.